Welcome, everyone. Very happy to have you on with us today. Let me start by just giving the quick update, and that is that there have been approximately 14.5 million cases worldwide and 607,000 deaths. In the United States, we've had about 3.83 million cases and 143,000 deaths. In California, we've had nearly 385,000 cases and 7,700 deaths. Here in Imperial County, we've now had 8,531 cases and 161 deaths. That does give us a case fatality rate of 1.89%. So let me go through the questions that were submitted. The first one is as follows. People cannot attend church services, children cannot attend school, most businesses are closed, yet the courts are calling in people for jury trials. What is the rationale? So all I can say is that the legal system is considered an essential business. And although it is encouraged to do whatever can be done remotely, and if not remotely, but then by using physical distancing, the essential businesses have to make that determination for themselves about what they can and cannot do in person. If you have specific questions as to why the court system has decided to resume some in-person jury trials, it will be necessary to reach out to them to understand how they made that decision. The next question is, it notes as follows. Since all Imperial Valley schools will begin online this fall, has ICOE and County Health discussed if high school sports will be allowed during the next school year? So the first thing that I would note, as you said, is that we will be doing distance learning, at least based on the current situation. Obviously, that's true over much of the state because any of the counties that are on the state's monitoring list at the time the schools are going to be open will have to have distance learning. With regard to high school sports, a final determination as to exactly what will happen has not been made. Like every other thing that the state has given guidance on, for youth sports, they will put out a guidance document, and until that occurs, then youth sports will not be allowed. It is possible that they may put out a document that does allow youth sports and may limit those to counties, for example, that are not on the monitoring list, meaning that if you're on the monitoring list and not having in-person school, then you may not be able to have youth sports either. Again, they have not yet put out such a document. I would note that when the document does come out, my expectation is that it will have the same kinds of measures in it that they have recommended for other industries and other places that have opened, meaning that it would be absolutely necessary to have appropriate physical distancing and lack of contact, and then all of the cleaning and other parameters are in place. So, for example, it's possible that they may determine that youth sports are allowed for non-contact sports and sports where there might be the ability to physical distance, and they could, for example, do that and then say that there would not be any audience. So all of this is speculation on my part because they haven't yet put the guidance documents out, but I can tell you that those topics have been discussed, and they will be releasing something at some point because obviously since we are getting to the point where schools are going to open, they're going to need to put out a document in that regard. Next, it asks if the county would allow large community events like cattle call, farmers market, or Christmas parades to happen this year. It goes on to note that since we are on the state's monitoring list, that does the Imperial County Public Health Department recommend that all large gatherings events be suspended for the remainder of the year? So first thing I would say is I wouldn't make any specific determination as to a time frame. It's only July. And so what will happen, say, in November or December, it's hard to predict now. But what I can tell you is that gatherings at this point in time are not allowed. They are not allowed by the state, and they are not allowed by the county either. So these kinds of gatherings currently would not be possible. But it is certainly possible that if there's a change in the way the outbreak is going, that would change. And since the end of the year is still about 5 months away, it is certainly possible that the situation could change significantly before that time. Next are some questions with regard to the CDC team that has been advising the county. The first one says, quote, when you say the team is working on binational outbreak investigations, are these workers who live in Mexico and cross the border to work in the facilities you mentioned? Next it asks, is the CDC team still with you on the ground? And then finally it asks to share any recommendations that they have made to us. So I'm going to turn it over to Paula Kreiner, who will discuss the answers to these questions.
Thank you. Yes, the CDC has deployed staff, and they continue to assist us with case investigations, in particular with binational cases, and those are individuals who may reside in Mexicali and cross the border to work in Imperial County. And they've assisted us with a variety of investigations, including our essential food processing workplaces such as One World Beef and Spreckles Sugar.
Okay, Paula, any other comments?
No, I don't have any.
Okay, so that's all the questions that were submitted in advance for this week. Let me just stop here to see if Tony Rojotis has any comments that he would like to make. And if not, then we'll check to see if any other panelists have comments, and then we'll talk about any additional questions that people might have at this time.
Hey, thanks everybody. This is Tony. No, I don't have a lot to add. I think we have some positive stories coming up for this week that we'll be sharing with the receipt of some mobile trailers that will be put in use for a couple different projects that we got going on, and I have Lindsay be working on that. Part of it's for the people that were displaced in Island, as well as part of Project Home Key to assist with homeless people during the COVID outbreak. So we will be sharing some additional information with that this week, and so be on the lookout for that. Thank you.
Okay. Anybody else on the panel have any comments that they would like to make? All right. So I'm going to open it up for questions since we have time. Keep in mind that if you ask a question that has to do with something that's numerical or otherwise requires data, we may not be able to answer the question on the call since we might need to research it. But I will pause and see what questions anyone who's on the line might have.
Hi, this is Tom Bodas from the Imperial Valley Press. I'm kind of curious about, I guess, as I understand it, they've scaled back testing to be people that are suspected positive at this point. And I'm wondering how that impacts us now if we're trying to get below that 8%, and now we have a smaller pool of testing to go from.
So to be clear, the state did put out some new recommendations with regard to testing. And I want to make sure that everybody understands the reasoning behind that. It is not because we really want to test different people than we were recommending before. We did it because the testing materials have become much more unavailable because of worldwide supply chain issues, as well as the big surge that we're having in many places across the country. Then that has led to both an increased need for testing and a decreased availability of testing. And this is not unique to Imperial County. This is happening all across the United States, as well as in California. The good news for us in Imperial County for the time being is that we still do have good test capacity. We still have the National Guard Gene Expert machine, which is running for us. We have significant capacity in our health department lab, and we still have our 4 OptumServe site lanes, which at this point in time are still getting test results back in a reasonable manner. So right now for us, there isn't much of a change. However, because of the general shortage, it is certainly possible that we're going to find in the coming weeks that testing is going to be more problematic, and that the turnaround time, for example, is going to be longer because of the lack of materials. Because of that, the state put out some priorities about how to make decisions about whom should be tested when there is limited availability. And so, as I said, right now, we're not going to really change much, but we are going to be sharing this document that came out on July the 14th with all of our providers. In fact, we've already pushed it out so that they understand that as we potentially do enter into a testing shortage, that there's some guidance about how to prioritize when the test should be done. All right, next question, please.
If I could please, it's Elliot Spaggett from the Associated Press. Dr. Munday, you gave us some numbers at the beginning about the number of deaths and number of total cases. What are the metrics or the numbers that you're watching most closely, do you think, that, and how do we follow along with you?
So all of the numbers are important, and they give you different snapshots about what's happening. So the testing positive percentage is really a measure of what's going on in the community. And so getting back to kind of the last question, let's just assume if the testing that we're doing is stable, meaning the number of tests, then changes in that percentage give us an idea of how this might be spreading in the community. Now, to the last question's point, if the number of people we can test changes, then it makes that number more difficult to interpret. But in general, if you assume that the testing capacity stays constant and you're testing these people, then if the testing percentage is going up, that suggests that there's more spread in the community, and when it goes down, there's less spread. There's typically a delay between what happens with the testing in the community and what happens in the hospital. And so they both give us useful information, because if we start seeing an increase in the percentage of positive tests in the community, then we are very careful to watch our hospital numbers, our emergency department visits, our hospital admissions, our ICU beds, and our ventilator use, because we have an expectation that if the positivity is increasing in the community, then there may be a delay, but that may later, a week or two, translate into increased numbers at the hospital. The one caveat that I would say that's a little bit different now, and not so much in our community, but in general, is that everyone's seen all the press about the fact that the age range for people that are getting positive has gone down substantially. And that has to do, number one, with all the testing that we've been doing. And number two, the fact that it's that age group that tends to go and do things that put them at more risk, because they go into areas where they get exposed to other people. Well, we certainly know that they can get sick just like anybody else, but the risk of it is certainly lower in that group. So we have to take that into account as well. But trying to answer your question in general, all of those factors that we measure are useful because they give us an idea of what direction everything is moving in. All right, next question, please.
Hi, this is Alex with KYME News. Are we still transferring out patients to out-of-county hospitals, and approximately how many? Also, with cases spiking in California, has it been more difficult to find beds for our patients here?
So to answer that question, oh, good. I didn't know if you're on, Kathy. Thank you.
Oh, yes, for sure. So this is Dr. Statza, EMS Medical Director. We do continue to transfer patients out. However, the numbers that we have transferred out have decreased. We think this is likely for a few reasons. First, both hospitals have increased their ICU capacity, so they are able to keep more ICU patients within county. Second, you're absolutely right. As we're seeing COVID cases increase throughout California, other hospitals' capacity is less. So we are really trying to focus on being able to increase our ability to care for patients. That being said, the state is still looking for ways to help Imperial wherever they're able. So we do continue daily conversations about transferring patients out if needed.
Thanks very much, Kathy. Next question, please. No other questions? All right, then. Well, I'll give you guys back some time. It's a fairly short press conference today. Thanks again for your participation. We appreciate all of your help and all that you're doing to get the message out to the community. Please continue to socially distance and keep yourselves and your family and friends safe. And please make sure that you are wearing your face covers when you're in public. Obviously, as new state guidance comes out with regard to what is going to happen with the education system and other industries, we'll be happy to share that with all of you. Thanks for your time Very much appreciate it. Bye.